Hey guys, it's Dr. Justin Marchegiani here. We are live on YouTube. We got a live Q&A sesh in the works. Make sure you click below, hit the subscribe and the like button. Put your comments down below. We'd love to know some great topics that we can chat about and do some more videos on. So what is going on? What's on the plate in functional medicine, nutrition, natural health world? So off the bat, a couple of things that I want to highlight regarding just things that I'm seeing with patients is a lot of mold issues. So we're doing a lot more mold testing. So we're doing a lot more plate testing to assess kind of moldy environments, which is helpful. I had a little mold issue in my house. I was able to test it. We were able to treat using some of the more natural treatments that are out there, more cutting edge stuff. And then on the retest, treat and see that it improved. So it's nice because there's more cost-effective ways to treat some of these mold issues. I mean, some of the more natural ways that were more expensive, there was a lot of enzyme therapy that was just, very expensive. And now we're using a lot more of the essential oil-based fogging therapies to treat moldy houses. And we're also trying to get to the root underlying cause of the mold. But we're seeing it on urinary tests where people are peeing out mold. We're collecting their urine and seeing how much mold is in their urine. That's helpful. And then we get a window into the house as well. That way we kind of look at it as what's your mycotoxin load and what's the house mycotoxin load. So that's very helpful to get a window because mold can be a stressor. I mean, if it's in the background and there and you have genetic sensitivity to it, it can be stressing out and depleting your glutathione levels. Glutathione is a powerful master antioxidant. It's going to help with expelling toxins. It's going to help with combating oxidative stress. So it's definitely important to be addressing. All right, cool. So mold's a big issue. Again, with mold, one of the big X factors is, hey, if you leave your house for a week or so, how do you feel? Do you feel better? These are important variables to look at. I think a lot of people can go down the mold rabbit hole or the Lyme rabbit hole just because any mold or Lyme symptom could be anything. And so it's really easy for someone that has adrenal issues or gluten sensitivity or gut issues to jump on one of those paths that may be a little bit more invasive. So I always say start with the foundationals and then work your way up. All right, Dennis writes in, what would cause vomiting yellow, bitter fluid every morning? It sounds like you're coughing up bile. That's what it sounds. Sounds like you have some bile issues. So I want to know why you're throwing up every morning. When did it start? What foods were you consuming? Obviously, I'm thinking we have maybe poor digestion. We may have some inflammation in the gut. We may have an infection going on. So I'd want to cross off the food, cross off, can we digest the food well? And then also, are there any underlying infections that are driving things up? From a symptomatic perspective, we could always do some activated charcoal and some probiotics in the interim to kind of get the symptoms under control while we get to the deeper issue. Hey, Anthony, hope you're doing well. Thanks for joining us on the Facebook chat. Awesome. Alicia writes in, what's the simplest, most cost-effective way to get out health in check? Also dealing with hypothyroidism and prior to total hysterectomy patient. Okay, so in general, first thing is just the diet. Get the food up and then increase the food quality. So if your diet's not good, make sure your diet's kind of on a standard paleo template. And then once you're there, you can improve the quality, getting step 4 meat, grass-fed, organic. That's the next step above that. If you're on a budget, you can always do frozen organic vegetables, much cheaper. You can always do free range over organic meat. And then the next step is to improve the quality. And then after that, once you've kind of tapped into that and you have good sleep, good movement, good hydration, and then once you're there, then seeing a functional medicine doctor is the next step, because then a lot of that's going to fix most of your issues. And then the last bit may be some cleaning and some pruning that a good health functional medicine doc could help with. Colin writes in, any validity to the conversation of not eating vegetables because of the high oxalates / natural plant defense mechanisms on going towards a more carnivore diet? I listened to Dr. Paul Saladino. It depends. So I've seen patients that have benefited from a carnivore diet, some that haven't. The more sensitive you are, it could be beneficial because some of these plant nutrients could be so irritating to your gut and to your immune system where the benefit of the nutrition that they provide is not enough to overcome the inflammation that is caused by them, right? So we have nutrition provided by the plants, and then we have the potential inflammation caused by the plants, right? Cooking obviously helps. Making sure it's organic helps. But some people may be sensitive. When you look at people like Jordan Peterson or Michaela Peterson, where they can't do any plants at all, where for them, the The inflammation caused by these plants may be here, where someone else may be here, and the nutrition that you get from them far outweighs it. Some people, it's the opposite and it's skewed. So I think it's important if you have autoimmune issues, severe gut issues, it's always worth doing a trial, going carnivore. I think you have to be careful though with the extra nutrients you may be missing. So adding in organ meat, I think, would be essential if you are going to go carnivore, and making sure your meat is grass-fed so you are getting a lot of good plant nutrients vis-a-vis the animal. But it's a great question to ask, and I think most people don't necessarily need it. Most people can do high-quality vegetables, and worst case, they just cook them and they avoid them raw, because that will decrease a lot of the oxalates and the anti-nutrients in it. But yeah, you got to work with someone. You can test it out in yourself, though, for sure. The Korvac writes, and does ginger help with bloating and help with detox? It does. It can help with inflammation. It's also a natural biofilm buster, so it kind of takes the protective shields out of the Spartan warrior's hands, so to speak, so then they can be attacked easier. But you'd want to, address the diet part. You want to address the infection part too. But it's very helpful on top of that. Thomas writes in, head feels groggy all the time and I feel fatigue constantly. What can I do? Start with the diet. Inflammation in the gut will create inflammation in the brain. How inflammation in the brain can manifest is through brain fogginess. A lot of the new antidepressant medications that are coming to the market they're working on inflammation in the brain. The problem is when you use a medication to treat inflammation in the brain, you can imagine there's going to be side effects, right? Let's just go back to early 2000 when they came out with Vioxx. Vioxx is a COX-2 inhibitor. It's a cyclooxygenase inhibitor. So it blocks this enzyme that can then lead to inflammation. The problem is that enzyme was really important for heart health and liver health. So people died of strokes and cardiovascular incidents, tens of thousands of people. So you have medications that could have that side effect. So what are natural things that we can do to reduce inflammation in the brain? Of course, cutting gluten out, working on leaky gut, because gut permeability equals brain permeability. Cutting the casein and the dairy out. Also, we can use certain supplements like higher dose fish oil, curcumin, resveratrol, maybe even CBD oil, things like that to calm down the inflammation in the brain. But we got to look at it from what's the root cause mechanism. Okay, appreciate it, Liliana. Thank you so much. Vivek writes in, if someone has infections, how can one improve fatigue issues while on step 1 of the AIP? Well, we want to look at why you have fatigue. There's 3 major reasons why you have fatigue. Number 1, it's going to be an adrenal issue. Number 2, it's going to be a thyroid issue. Or number 3, it's going to be a mitochondrial issue. Mitochondrial meaning there's issues with foods coming into you or absorbing B vitamins, CoQ10, carnitine, these nutrients that help run the mitochondria, which is the powerhouse of the cell, which generates ATP, which is basically, the currency of energy in your body. Anne writes in, if you don't have a gallbladder, do you have to take bile salts for the rest of your life at every meal or just high-fat meals? Yes. Well, every meal you should have, for the most part, should have fat in it, on average, right? So yes, because you have an organ that's removed, you will need to make up for the lack of that organ. It's like if you had your pancreas removed, would you have to be on insulin the rest of your life? Yes, you would be. Same thing. A lot of doctors and general surgeons will say, well, no, the common hepatic bile duct can compensate for the gallbladder being removed. It's like, yeah, but the gallbladder concentrated your bile salts like 15 to 20 times more than your liver can, number 1, and it can spit it out at the right time. Now the gallbladder is gone, you're just going to drip bile all the time. So yeah, you definitely want to have good quality bile, as well as maybe HCl and some enzymes in the background for sure. Can you tell me what causes bone spurs, and is there something that you can do to get rid of it? My husband has it around the sciatic nerve. So typically when you see bone spurs, it's because of, one, a lot of force in the joint, right? And a lot of typically malabsorption of force. So first thing is make sure your muscles are pliable and turned on. So a good kinesiologist can test the muscles in and around that area to make sure anytime there's inflammation in an area, let's say it's your knee, I always look at the knee, but always look at the stability of the joint above and below. That's like number 1. If you see buckling in the first or second floor of the house, I'm always looking at the foundation, right? So that's first. And you may use soft tissue techniques. And then we also want to look at, are we over-exercising? Is there an over-exercising issue? And then also number 3 is, are we getting nutrition in, like collagen, amino acids, good minerals, to be able to turn over and provide building blocks? So if it's gut issues or absorption issues, that can be a big thing too. So multifaceted, you need to bring some experts involved there to dial that in more specifically. Rashawn writes in, how do we figure out how many digestive enzyme pills we need so that we're not taking too much or too little? Enzymes are a little harder because you're not getting that warmness or burning sensation that you may get with hydrochloric acid, right? So I always say, get your hydrochloric acid dose dialed in first, because hydrochloric acid actually activates enzymes. So you're going to have more enzyme bang for your buck with an environment that's going to be proenzyme, meaning a lot of these enzymes are pH sensitive. So if we drop that pH down nice and low, maybe around 1.5 to 2.5, that's going to activate more of our own enzymes. And then we may need less enzymes as we add them in. So kind of take inventory of kind of your digestive symptoms. I typically start at 1 and I'll go up to 3, and I'll just see if my symptoms improve. Like I have some patients where they're like, yeah, when I go to 4, I really feel better digestive wise. And then they may stay at 4, or they may just stay at 4 for their bigger meals. So we really have to fine tune how much food you're eating and then how you feel as you titrate from 1 up to 4. Okay, excellent. Can I heal gastritis and small intestine for dysbiosis with bone broth? Not fully. Will it be significantly helpful? Yeah, it will be. It's like, okay, you got a fire inside the house, but you're putting a little bit of fire on the roof where it's coming out. Will it stop the fire? It'll stop it from spreading and maybe help a little bit, but it won't fix the root. Girish writes in, I'm diagnosed with ankylosing spondylitis, and for the last couple of weeks, I'm experiencing pain in my right shoulder and cannot raise my right hand. So ankylosing spondylitis is an autoimmune condition. It affects the lower part of the spine, and it just basically causes your spine to become like concrete. Big bacteria involved in ankylosing spondylitis is Klebsiella. So bacterial overgrowth is a big thing. Obviously, all the gluten and leaky gut stuff. So you need to see a good functional medicine doc that can get your diet right. They can look at your microbiome and work on that. Alicia writes in, what do you think about the GAPS diet for gut health if you're dealing with severe gut inflammation? I think it's helpful. It's very similar to an autoimmune template. I'll kind of use it interchangeably with an SCD or specific carbohydrate diet. I think it's an important tool in any functional medicine doc's tool belt for sure. All right. CW writes in, can you take DE every day? I mean, you can. It definitely make sure you're taking it away from food because it can bind stuff up. I wouldn't do it all the time, but a few months I think is okay. It's really good for binding up, junk and helping with worms too. So, and it can dehydrate you a little bit. So make sure you're consuming extra water to basically factor that in there to overcome that. Liliana writes in, my IG doctor told me I have bacterial H. pylori. Can this be a reason for my iron deficiency? Yes. 3 major reasons for iron deficiency. Number 1, you're vegetarian, vegan, you're not eating good quality iron from animal products. 2, you have estrogen dominance and you're menstruating excessively as a woman that's of cycling age. So that could be more than 4 tampons a day for 2 or 3 days in a row. And then number 3, there's a malabsorption, whether it's from infections or from low stomach acid or enzymes. Totally true. Oliver writes in, do you know anything about peptide for injury recovery and example BPC? Yeah, I've heard Ben Greenfield talk about it. I think there's some promise with that. Don't know it personally, but I have heard about that. Your thoughts on spirulactone? Is it dangerous? So spirulactone it works, I think it's a blood pressure medication, but they give it to women to decrease androgens, if I remember correctly. So spirulactone, they'll give it to women that have PCOS or excessive androgens. A lot of times women have excessive androgens because they're insulin resistant. So you got to work on the insulin resistance and the inflammation. Vivek writes in, why does it make sense to combine step 1 and step 2 of 6R removal protocol, removing bad foods and adding HCl and enzymes together from the start? Well, because number 1, if you're adding good foods, but you don't have enough HCl and enzymes to break them down, good foods can sit, rot, putrefy, and ferment in your gut and still create stress even though they're healthy. Imagine coming back from Whole Foods, you have all this good, healthy food. It's perishable, right? It's meats and such. You throw it on the counter and you leave it there for a week and don't put it in the fridge. That's what happens in the equivalent in your gut when you don't have enough enzymes and acids to break down food. It ferments, it putrefies. You may see burping and belching and flatulence as a result. That's why it's really important. Akbar writes in, can we take all types of probiotics, lactobacillus, bifido, S. pylori, and sporebiotics, all 3 at the same time? Yes. you can. Just make sure you add them in one at a time to make sure you tolerate them. Why does licorice and adrenal revive give me leg cramps? What is the solution to leg cramps in general? If I see leg cramps, I typically look at potassium and magnesium first. You can also add a little bit of apple cider vinegar in there. That helps to mobilize minerals as well. So apple cider vinegar, and then you can also do some potassium, whether it's from cream of tartar or new salt, like a potassium chloride, and then you can always do magnesium as well. That's very helpful. Okay, good, excellent. Let me check my Facebook people here. Okay, here we are. I'm gonna pull it up on my. Okay, good. Anthony writes in, I believe I have Baker's cyst from doing squats. It's about the size of an acorn. What's the best treatment? And should I see a physician? Not sure about the Baker's cyst. The question is, how do you have it? I would need to do a little bit more reading on that. So how did the cyst happen? Is it something where it's just in the superficial part of the skin, or is it deeper? It may need to get drained, because draining would help it heal. So if we can drain it, that may make sense. But the question is, I want to know how it actually happened to begin with. I want to make sure the root cause is fully addressed. So we got to keep an eye on that. Okay, good. My dad's 58 years old. I had a VCS recently for hydrocephalus, and now we are waiting for biopsy results. What diet supplements would you recommend here, and what alternative route for chemotherapy? What does VCS stand for? You need to get a little bit more info. But of course, a high quality anti-inflammatory paleo kind of alkaline template's going to be amazing. Keeping the carbs down too. Thank you for mentioning wellness meats a while back. I have a small city and needed to find a cleaner meat. You're truly a huge help in my healing process. Awesome. Thanks, Ann. I appreciate it. Yep. Go to justinhealth.com/meat. That's where I get a lot of my frozen meats. They do a really good job. Excellent, high quality. Kelly writes in, morning, daughter with autism is having debilitating nerve pain, wheelchair. Her TSH was tested in the hospital around 4.25. It's high to me, and they would not treat her. Could this be fibromyalgia? I mean, the question is, anytime there's autism, there's typically some level of brain inflammation. There could be many causes why. The TSH is definitely on the higher side. The question is, what's T4 look like? What's T3 look like? Are there thyroid antibodies? So I definitely want to dive in deeper to know what is going on. So I really want to look a little bit deeper. Some foods are triggering bloating within a matter of 15 minutes due to small intestine inflammation and no gas, both of which seem to indicate it may not be SIBO. Any insights? So if it's in a few minutes, it's definitely happening in the stomach. So I would look at potential H. pylori and bacterial overgrowth there. So we definitely want to look in deeper with the stomach. Is ankylosing spondylitis curable? I mean, it depends. One, I got to be careful anytime we talk about cure, because the medical monopoly has a monopoly on cures because of the FDA and because only a drug can cure a disease. That's number one. Number two, can we suppress the symptoms of the condition so it feels like it's gone by getting to the root cause and promoting wellness? You can see I have my legal speak going. Yes, we definitely can do that. Matter writes in, your protocol says take probiotics after finishing with antimicrobials, but there's a good research out there that says taking antimicrobials and probiotics simultaneously has the most bang for its buck. It can. It just comes down to how many pills do you want to take. It really depends. Some people will add in specific strains during, but as a rule of thumb, to not overwhelm patients, because if I have the best protocol for you, but you can't do it because of financial or emotional reasons, compliance reasons, then it's no good. So there's a combination of doing what's best and then also making sure the patient can do it and feel compliant. So again, it really depends. I find you're going to have a better bang for your buck with probiotics hanging around later, doing it afterwards. So I'm very familiar with that. It all comes down to getting the best compliance. But I do think you have a better bang for your buck with probiotics taken away from antibiotics. But could they still be effective with? Yes, but we got to be practical. This is the real world, and we need patients to not take a million pills at once. As a rough estimate, is there a good general sense of how many enzyme pills are too many? Anywhere between 1 to 4 may be okay. Anywhere between 1 to 4 may be okay. How do you know bile salts or lipase is needed? Well, if you're seeing your stools on the floaty side, shiny, greasier, you're seeing skid marks in the toilet seat, a lot of excessive wiping, that's a good sign that you may need more bile salt and fat support. IKO writes in, zonulin score was 350, went on a carnivore diet with coffee for 2 months, retested, came back at 400. Yeah, there could be some infections going on. So there may be other things going on that's not addressed strictly by the food. There's a lot of levers that could be present, meaning food's one lever that we have to move, but there could be infections and inflammation and probiotic and bacterial imbalances. We have to dive in deeper, okay? Got to dive in deeper. Okay, excellent. Keep on rolling here. My son might have a ganglion cyst around his wrist. Will it eventually go away? I mean, it's benign. You can keep an eye on it. I would do some enzyme therapy taken away from food, higher dose wobenzime, and that could potentially help. It will help with inflammation, but it could also help with that. But just keep an eye on it. It's benign. Doctor says, doctor, what is your take on wobenzime? Man, I just talked about that. That's like perfect timing. I think it's very helpful. I do like it a lot. Do you have any advice on someone that has a low-grade prostate infection? I assume inflammation needs to come down. Doctors want to keep giving antibiotics. Yeah, so you got to get the food down. There could be bacteria, something in the gut going on. So you got to dive in deep to all those various areas. Cadmium and some metal stuff can be an issue too. So work on the food, work on the gut, and then dive in deeper. Excellent. What's your noticing the high carb diet triggers pollen allergy next day? Any thoughts? Yeah. So definitely take a look at my podcast from last week on Monday, all on allergies. What's your protocol tips for inguinal hernia? It's hard to say. If you're born with it or happens when you're younger, it's tough. I mean, you can do some core stabilizing exercises. So the muscles that hold the organs in are more strong, so that can happen. So keeping inflammation under control. If it's really serious, you may have to get it operated and have some mesh put in there. What if stool is not floating but still greasy, as in skid marks? What could be the issue? Well, get the bile and the enzymes dialed in, but then you may have to dive in deeper with other things regarding infections and gut issues. All right, guys, hope that is awesome. Today was great chatting with you. I got to run to a patient call. I may be back later on this afternoon, so look for notifications. I really enjoy these talks. I missed my chats with y'all last week, so great connecting. You guys have a phenomenal Easter weekend, and we'll be in touch. Take care, y'all.